and for really managing all the Q&A really well. The questions were fantastic that came in. And so we are moving on to the final stage of the session, which is with our panel. We're continuing the topic of mental health and well-being, because it is just such an important topic that, you know, it affects us all during this particular kind of pandemic that we're going through. So if I could just ask the panelists to show themselves. Yep, great, because I'm just going to introduce everyone. Okay, fantastic, great. So I'm just going to introduce Professor Eilis Hennessy there first, who's on to the left of my screen. So Eilis is a professor in the UCD School of Psychology. She's a developmental psychologist, and her research focuses on how stigma is expressed and experienced by young people with mental health problems. Then Dr. Emelina Ellis, excuse me, is the Clinical Excellence Lead in Spectrum.Life, which is UCD's employee assistance service provider. And she's responsible for the day-to-day management, development and ongoing review of the employee assistance service, strategic planning, as well as overseeing the service delivery of the employee assistance service in Spectrum.Life. And then we also have Professor Graeme Warren. So Graeme is a professor in the School of Archaeology in UCD, having been appointed in 2002 to expand the school's practical teaching skills and provide specialism in early prehistory. And Graeme is a past head of school as well in the School of Archaeology, and he is a member of UCD's Mental Health First Aid Peer Support Panel. And we have Joan is staying with us as well, which is brilliant. So we can, you know, field any further questions people may have for Joan as well. So I was just going to start off with Emelina, because maybe you might just talk about maybe some of the common themes that are emerging. That you know, that are coming into the employee assistance service that you would see, particularly I guess during COVID-19. So it would be great to kind of hear what are the main issues that are arising.
Thank you very much, Marcellina, and thank you to everyone for having me here, you know, in this panel today. And I suppose, you know, just to start talking about, you know, we know that COVID has had psychological, you know, impacts globally and on everyone. However, I think that, you know, it's incredibly important that we address that there are many different factors contributing to how this impact has been on different individuals, and that indeed there are some disparities, you know, in the impact and variables, you know, such as ethnicity, age, you know, specific comorbidities for people. These things will contribute to the impact that it would have. You know, we have other variables like, you know, specific people who have lost, you know, loved ones, people who are physically distanced from their support network, people experiencing, you know, or who have experienced economic loss, people who had previously experienced, you know, perhaps depression or anxiety or insomnia, or, you know, substance abuse. So there are many different factors that would kind of indicate the vulnerability and the impact that people and individuals will have as a result of COVID-19. Some of the effects that we have seen, you know, it's an increased presentation of people, you know, talking about feeling lonely and feeling isolated. And some of the things, you know, that we have noticed is that perhaps, and particularly, you know, in individuals and in employees working remotely, we can sometimes spend days without speaking to someone, because we are working, you know, we may be in meetings with people, but we're not really talking or connecting you know, with people. So having those conversations, and that can absolutely, you know, lead to those feelings of loneliness and feeling isolated. We have seen increased levels of anxiety, you know, people perhaps feeling really worried or concerned about themselves or their loved ones, increased levels of stress. I mean, the pressure to be, you know, switched on 24/7 as well. You know, we have seen people who said, you know, perhaps on this remote workplace, am I working from home or am I living at work, you know, because the laptop is always there, so I can always just check this email, which we know, you know, that being switched on 24/7 and not having very strict boundaries can lead to burnout as well. And, you know, if we're not taking our time to self-care, that can lead to, you know, stress difficulties, anxiety difficulties, and potential burnout. We have seen an increase levels of people presenting with low mood. Again, you know, even thinking about people who have experienced the loss of loved ones, we have people presenting with bereavement, people who may not have access to their conventional, you know, support network, or their to go to things, you know, to self-care, like exercising, going to the gym, like all of these different things, you know, have resulted perhaps in that experiencing of low mood, and then contacting the services, which, you know, we're always incredibly delighted when somebody does contact, you know, the service, because then we can start that conversation and get them the support and the resources that they need.
That's really great. Yeah, I'm sure the majority of us can certainly identify with this thing of being switched on all the time, and, you know, the evening working as well, as we're trying to juggle caring responsibilities and everything else that we're trying to do whilst we're remote working. And what tips could you give, or do you provide to people that contact the service, in terms of, you know, how do you switch off?
Thank you, Marcellina. I absolutely, you know, just when people contact our service, they will be speaking directly, you know, that first point of contact, it's a qualified and accredited counselor and psychotherapist. So they would be listening to, you know, what is happening for you right now. They would be assessing where the person's at and where you know, what they need, and then they would work on a tailored, you know, program to support the person. If I was to talk about, you know, very, very general, you know, tips and strategies on, you know, that kind of remote work, one of them would say, and I'm saying actually remote work, and for some, you know, are now caring for, you know, children or perhaps, you know, adults as well at the same time as we are working. So it's this kind of multitasking that is happening as well. So something that it's incredibly powerful is to create a routine and to stick to a schedule. It really, you know, sets you up for the day. If you outline the goals that you have for the day and the things that you want to achieve for the day, and those may include, you know, your family responsibilities, but also your work, you know, schedule and responsibilities. I always talk to you know, to our clients about boundaries and the importance of boundaries. You know, again, going back to, am I working from home or living at work? It's important that, you know, you know that there is a time in which you are going to be at work, and there is a time in which you are going to be, you know, at home, and using time and actually scheduling time for yourself. So give yourself permission to switch off. I think that this is really important, just because, you know, the laptop or your equipment, or you may have your mailbox in your phone, just because it's there, you know, doesn't mean that you have to check it. If you finish work, switch off the notifications, you know, so that you don't get the email kind of pinging to you, and then you feel that you need to respond. This is something that we have noticed, you know, that increased pressure on, oh, if I receive an email, I want to respond very quickly so that people see me that I'm working. you know, because they can't see me, you know, physically in the office. I want them to know that even having a dedicated space to work now, not everyone has the ability to have, you know, a home office. We acknowledge that, but even having, you know, if it's a desk or a table that you work on, by the end of the day, close that laptop, put it away, you know, that dedicated space to work, it's really important, but also your home environment is important, that it doesn't get kind of mixed up. Schedule breaks during your day for fun and enjoyable and self-care activities. This has to be part of your schedule. It's not an option, it's not a luxury. We need to look after ourselves and we need to have these breaks. Sometimes even having on your calendar, you know, schedule to get up and move a little bit. It may be that you're doing a specific class exercise, you know, a little bit of movement, walking, yoga, but having exercise and movement as part of your routine whilst you're working from home. Again, it may look different from what you would normally be doing if you were someone who went to the gym or, you know, or to a place like that. But even having walks, you know, around your house, you can connect with nature, but also we know that we boost our endorphins and our serotonin, so that is going to immediately make us feel better. But having space scheduled for it is really important. Yeah. And I suppose lastly, you know, and following on from the wonderful talk, you know, that Joan Freeman had a few minutes ago, you know, talk about it, check in with yourself, check in with your friends and with your colleagues. You know, it's really important to add to that culture of care and openness, you know, to identify who your mental health first aiders are. They are there, you know, to speak with you, the community, you know, to feel that you are surrounded and that there is a support network, even if you can't see them, and that we schedule even those check-ins with our colleagues as well as part of our day-to-day. So I think that because we don't see people the way that we normally would, you know, in the office, we may not see if someone's, you know, looking differently, or maybe, you know, is not talking as much, or maybe they're not getting up to go have their lunch and all of these things. So I would say, you know, actively schedule check-ins with people, ask people who they are, you know, how they are. And if you feel that they may benefit, you know, from any support, signpost to the AAS, you know, to the AAS, to the Employee Assistance Service. You don't need to have the answer. That's really important to know. But if you signpost people on to get the help that they need, this can be incredibly powerful.
Yeah, no, that's really, really helpful tips there. And I think the message coming out is that you have to be disciplined and kind to yourself, you know, and to say it's okay not to answer that email. And as an employer, I think we have to really drive that message home as well to people that, you know, you're not meant to be on all the time. So that's been really helpful. I might just move on to Eilis for a minute. Eilis, I'd love to hear a bit more about your research, actually, if you wouldn't mind maybe expanding a little bit on that for us.
Sure. Thanks, Marcellina. So my research is mostly with young people, but also with their parents and with teachers more recently. And we're interested in stigma, the way in which stigma is experienced, and as well the fear of stigma, which is actually a thing which affects a lot of people who are mentally distressed. Most particularly the focus on, or at least one reason for focusing a lot on stigma, is because we know that stigma is associated with help seeking. So in other words, the more you believe that mental health difficulties are stigmatized, the less likely you are to seek help. So it is about ensuring that we reduce stigma as much as possible, because that will facilitate help seeking. And that's true within schools, it's true within UCD as a workplace, and it's true within families. So it's all of those related areas.
Yeah, and you know, stigma is such a you know, it's a really important kind of aspect of mental health and well-being to raise, because you know, trying to encourage people to come forward to seek help and support when they need it is I think something we're finding as a challenge, and I know Graeme will talk about the mental health peer support group in a minute, but you know, in terms of people using the services that are available and coming forward to seek help and support, you know, I think the numbers are still quite low from what we can see, and it's just, how do we encourage people to seek the help they need, and to, I suppose, how do we, you know, get rid of that stigma, or the perception that the stigma exists? You know, what can we do in that space?
Yeah, so I mean, I think you're absolutely right. And it is, there's no easy answer to that. I mean, some of that is about doing what Joan suggested, which is you create a culture of acceptance, of inclusion. You create a culture in which it's okay to talk about mental health. And that is really important. It's important to tell people to, you know, to provide good information on maintaining mental health and what to do if you feel that your mental health is suffering. So having the information and the knowledge at your fingertips is really, really important, and that helps. It's important that people, so I think in one way information is important, because if you know how treatable the vast majority of mental health conditions are, then you're far more likely to seek help. If you think nobody can help me, there's nothing can be done for me, then why would you look for help? So it's important that we give people good information. And I suppose my background is developmental psychology. So I think the more we can do with young people in schools, in colleges, the better, because the real way to try to address stigma is to address it with young people and ensure that it doesn't become entrenched and it's not you know, built into society. So those, I suppose public health messaging helps. So there have been some very effective I think publicity campaigns, you know, indicating that it's okay to talk to somebody, to say to somebody, how are you feeling, when you know that they have been out with a mental health problem. Nothing terrible is going to happen. They're probably delighted that you're welcoming them back and acknowledging that they are welcome within the workplace. So all of those things I think are helpful, but there's no one magic bullet, unfortunately.
Yeah, absolutely. And I suppose, as you were saying, it's the culture as well. And like, again, going back to as an employer in the university, it's the culture we create within the university and starting the conversation, I guess, so that people get the message that it is okay to talk about mental health and well-being, and that it won't have I suppose, any negative impact on their, you know, their career within the university or their opportunities. And I know you're a member of the mental health and wellbeing steering group, Eilis, in the university. So do you want to just say a little bit about that group that was established recently?
So this is a recently, relatively recently established group. Started. We've had our initial meetings, and the idea is that we're going to sign up to the Sea Change pledge. So Sea Change is a mental health charity that really attempts to reduce stigma, and they have a workplace initiative that has a series of steps that a workplace or an employer can implement in order to reduce level of stigma. So within UCD, one of the first things we're going to do is all of the members of the group are going to actually themselves take on the Sea Change training. And that's now been scheduled for the beginning of April. As a group, we're going to work, we're going to be, I suppose, a consultative group for best practice in supporting people's mental health around UCD. We're going to develop an action plan in order to promote mental health and well-being. We're going to raise awareness, and we're going to develop a policy for staff. And in fact, a few years ago, I sat on a similar group that produced a mental health policy for students. So I think this is a very important development now to have the same for staff.
That's great, Eilis. Thanks for filling us in on all of that. So, so I think, as Joan was saying earlier, the policies are important, and then it is what we build around that policy then, in terms of the training and awareness raising, and ensuring that those supports are in place. And Graeme, might just come on to you actually to talk about the mental health first aid peer support group, and so you're a member of that. Do you want to just share a little bit about what that group, the role of that group, and how that can support employees in UCD, and how it's going, you know, how successful it is, or how you think it's helping to support employees in the university? I think you're on. Can't hear you, Graeme. I'm not sure if anyone else can hear. No, I'm not. Can't hear you. So we'll just give Graeme a second there, actually, to yeah. Yes, I think
Can you hear me now?
Yes, we can. Yeah, yeah, perfect.
Can you hear me now?
Yeah, yeah.
Okay, that's very curious. Okay, apologies for that. Thank you, Marcellina, and thank you everyone. Thank you everyone else. I suppose the first point to say about the mental health first aid panel is that this goes back to pre-pandemic. And I think it's really important that we recognise that although the pandemic has made many things much harder for people, many of the issues were there beforehand, and they've been thrown into sharp relief. And actually, the pandemic has shaped how the panel works. So that, as I understood it, the mental health first aid panel was there to provide a level of support that wasn't really there. So line managers would know about things like the employee assistance program, and if someone in trouble came to them, they might be able to pass that on to them. And they'd know that you could refer people to GPs. But those are both quite formal or quite big steps. And being able just to be that signpost, which was being talked about before, to be able just to pass people on and help people move in the right direction, was a really important level of support to have. And I think really important as well that people had someone they could turn to that wasn't their line manager, that wasn't their head of school, that there was someone else within the institution who they could say, actually, I'm not okay at the moment, and I'd like some advice as to where to go to. And I must admit as well, from a personal perspective, I found that I was playing that role for lots of people anyway. Lots of students came to me, lots of staff from within the school came to me, lots of staff from outside of the school came to me. And I was actually very pleased to be able to get some training, to know that the kind of advice I was offering was hopefully in the right space. The uptake of the mental health first aid panel has probably not been what we would have hoped for this year, and I think that's where the impact of the pandemic and working remotely has been hugely significant. That the idea initially was that we might go for a cup of coffee with someone, have a conversation with someone, be able to have that informal meeting space, and very few people have reached out to us in a fully remote environment, and that may also be because there's a lack of awareness of the service. The one panel member we have who's working in a real physical environment, they're in a medical part of UCD, so they have been working on the equivalent of their campus over this pandemic period. They've had lots of contact and lots of discussion, and it's our expectation that when we come back to UCD, whenever that day may be, that we'll actually see a significant uptake at that point.
Okay, that's great. And I'm hopefully that will be the case. And I think you're right. I think being off campus can impact. It's not the same meeting someone face to face and having a chat and a coffee. I know some of the some people have indicated that maybe the name sometimes can be off-putting, mental health first aid peer support panel. So we might look at that, but again, maybe that's a kind of going back to the stigma piece. Maybe somebody's afraid of contacting a mental health first aid panel because of the name, So I'm actually, there is a question in the chat that I'm going to ask any of you to answer, and Joan, please feel free to jump in here as well. One of the question says, one of the things that I find very distressing is the blame game, that when somebody dies by suicide, that they are selfish. To even entertain the idea of taking one's own life, and the pain that the person must be suffering has to be so blindingly overwhelming. And then thank you for your talk, Joan, so crucial at this time in particular. So I might just ask you, Joan, to comment first on that, if you can see the question there, but it's about, yeah, distressing when somebody dies by suicide, you know, that the opinions that people might have that the person's selfish.
It's an opinion that is sort of decreasing over time, for sure. I mean, that would have been a very common sort of comment many years ago. The reality is that someone who dies by suicide, and especially the ones who leave a note, the word love is very obvious in that note. But also, you know, when people are coming to us in Pieta House, and one of the first questions would be, you know, why do you want to die? And their response is always, because I want to stop the pain. And their second response would be, I also see myself as a burden to others. So the reality is they're not selfish. They see themselves as a burden, and it is our job to make sure that they realize that they're not, that they're loved. But usually then that question of why do you want to die is followed by, so why do you want to live? And that's a really important question, because for the very first time they think about the reasons for living, and there are always outweigh the reasons for dying.
Yeah, that's a really powerful way of looking at it, Joan. And I know there's some comments here that the historical stigma, for example, associated with mental health is a huge issue. It's always been seen as a weakness and was kind of locked away. So again, it's relating to the stigma, and it's a question about, you know, how can we educate people? How can we best raise awareness? You know, so is it a training program? Is it a campaign? You know, what do you have any comments on any of that, in terms of, you know, what should we focus on over the next year, in terms of trying to reduce the stigma associated, to try and raise awareness? Does anyone have any kind of tips maybe for what we should focus on the coming year in particular?
If I could just say one thing here. I spoke earlier about the culture, creating a culture of acceptance, and besides, you know, I'm taking the next few days off. I'm having a really mental health issues at the moment. But say someone comes back from being absent from work, and if they had flu, your first normal reaction is, well, how are you? How are you feeling now? Do we do that when it's about mental health? You know, do we have that same natural curiosity how that person is doing? So we have to start ourselves. As I said, all the policies in the world, all the training in the world is not going to do anything unless you take responsibility yourself of how you are, what you're like in the workplace.
I think that's a fantastic comment, because that's what we're trying to do in equality, diversity and inclusion all the time. Our first line is almost that equality, diversity, inclusion is everyone's responsibility in the university. You know, that it's unless we all play a role and all take a responsibility in making the university more inclusive, and to making, you know, mental health something that absolutely is okay to talk about, and not that it's something that we're afraid to raise, or you know, I think people might be afraid they'll put their foot in it, that they'll say something wrong and upset someone, you know. So I think it's about saying, look, it's better to say something than nothing, and to let on it's not happening. And Emelina, just I see that you've come off your you've put on your mic there. Do you want to chip in?
Absolutely, Marcellina. And it actually, and you know, just to echo what you just said, you know, that people may feel like, oh, I don't want to say the wrong thing, but you know, from our experience on speaking with people who are, you know, struggling or experiencing mental health, there is never somebody thinking, oh no, I was asked the question and that made me feel, you know, unsupported. It's about talking about it, about sharing our own experiences, you know, that we may have, and also how we went about it, you know, where we accessed our supports when we needed them. So it is about health. It's about mental health and physical health, and not separating them. As it was mentioned before, you know, if I break my leg, I'm going to feel very comfortable in you know, showing up to A&E and saying, I'm in a lot of pain, please do something about my leg. I'll be telling people what happened, you know, what happened to me. But at the same time, I would like people to ask me, how is your leg? So it is exactly the same way, you know, when I am experiencing, you know, low mood or anxiety, or when I have experienced losses, when people ask us, how are you doing? And we're able to then connect. And then there is a permission to, you know, to talk about these things. It's not a weakness, it's a strength to be able to talk about these things. And that is always the first step. Once we talk about it, then we can access the supports. Then we know that we're not alone, and that we're humans, and that it is part of our health, just the same way that having a flu is part of our health.
Absolutely. Yeah, no, and I think that's a great way to finish up, because I know we've actually come to 12 o'clock now, and so I just want to say thanks so much to Eilis and Graeme and Emelina, and particularly Joan, for staying on as well. And just to say, Joan, that I just loved all the personal stories as well. I just think that that's so powerful to hear all of that, and just I was really glued to what you were saying. So thanks so much again for coming into us. But thanks to all of you, and obviously to Calmont earlier on, and to Colin as well for you know, for managing most of the session, and for launching our annual report. And just to thank everyone for participating as well at the event today, for listening in, and that we will send the link to people of the session afterwards. So so thanks very much. And also, how can I forget, thanks to Tom and Leisha, as was said already, for really pulling it all together today, because there is a lot of work in the background, that even though it's just a 2-hour slot. So thanks to them as well. Okay, so thanks everyone. Bye bye.